Welcome back to another discussion on Workforce 4.0. Hola, I'm Joe Pardavila, and of course, joined by Gerard Szatvanyi. Jerry, how are things in the Big Apple? You're still in New York City?
Great. Every day is a new experience, and it's a very rich experience, so I'm enjoying my time here.
Excellent. And today we're going to get into a subject that we've touched upon several times during the course of your podcast, and that's healthcare. And we are seeing the ways that AI is being implemented in it. And so we figured, let's get somebody down on the ground doing it, creating it. And joining us today is Rajan Kohli. He's the CEO of CitiusTech. Rajan, welcome to the podcast. How are you?
Thank you, Joe. Great to be here. I'm very good.
Now, Rajan, you guys are one of the leading healthcare tech companies out there. But before we get into the nitty gritty about AI and healthcare, let's talk about how CitiusTech is a mover here and making things happen with AI.
Yes, absolutely. We are a company 100% focused on health technology services. We serve the payer market, the provider market, the medtech market, and the life sciences. So the four pillars of healthcare, we serve all of them. 100% of our revenue comes from healthcare. And as you said, we are in tech services. A large part or a growing part of our business today comes from data and AI services.
Nice. And one of the things that technology needed to happen with healthcare was, as you know, Rajan, but people watching your show may not know, is that around 2009, the healthcare industry went all in on EMRs or EHRs, electronic health or electronic medical records. They essentially, for the first time in the 100 years of medicine, they said, hey, you know what? It'd be a good idea if we had an electronic record of this, as opposed to 10,000 pages in duplicate. So tell us how you've helped with that in terms of decluttering the mess behind the scenes in the world of healthcare and paperwork.
Actually, that's a great question because I don't think we would have grown to be who we are if that was not the case, where the electronic health record did not get such a big push, such a big incentive from the government during that time. So we are celebrating our 20th year anniversary this year, in fact, just last month. And a big reason for us growth and 100% focus on healthcare was because the acceleration that we saw in our own revenue. Now, you're right. Digitization and electronic record are fundamental to the digitization that is going on now. But through GenAI, actually, we're trying to solve for some of the problems that this focus on health records or electronic health records caused. A good example of that is a physician that you now go and meet who's actually typing all the time versus actually engaging with you, building eye contact, building a relationship with you. That has stopped. And through GenAI, we are now trying to refocus the physician back into establishing that connect and letting the GenAI do rest of the grunt work for him or her.
Yeah, that's a big push. I know that's one of when people talk about the immediacy of what AI can do, that is one of them. I forgot the name of the platform that does it, but essentially it's a dictation device that instead of the doctor, like you said, staring at a screen, is just talking, recording it, and then synthesizing the data and then putting it into the EHR in a way that now all of a sudden doctors can actually see their patient, as opposed to the patient seeing their profile as they're staring at a screen. So that's one of the big game changers. But let's start with those game-changing things. Big picture, what are the most important AI-driven shifts you're seeing in the healthcare industry today? Because if my math is correct, you guys have been around for 20 years, but the electronic health record is probably about 15 years old. So you've seen a lot of change there. But what's happening right now with AI in healthcare?
So I think so I'll talk about the three shifts, I think, specifically in healthcare. The biggest one is I genuinely believe that GenAI is genetically designed for healthcare. I'll tell you why. It actually solves for the big problems that healthcare has. The biggest problem that healthcare has, this is probably the only industry where you have digitization, yet a lot of fax-based information coming into the system. People are still sending faxes, even today. GenAI will allow us to reconcile all of this data coming in different formats. And that is why I feel GenAI finally is a technology that is genetically designed for healthcare. Second, I think AI is becoming default in healthcare already. If you look at the EHR system, whether it is Oracle Cerner or Epic, which are the two main dominant systems, they already include a number of Gen AI algorithms within, right? So people are used to it, physicians are getting used to it, it is becoming a default in the system. A third, why it is a game changer for healthcare, I think it's perhaps the only industry where people are doing it not to save cost, because there are not enough physicians, there are not enough nurses, there are not enough talent to serve the today's needs that the industry has. And Gen AI is actually helping solve for those needs. So the reason to do this is much beyond cost. It is about patient experience. It is about allowing a vast number of people, underserved people, to get access to healthcare. So there are a lot more novel things in play. That's why I feel this is the right time, the right industry, the right opportunity for finally healthcare to not be a laggard in something which traditionally it has been, let's face it.
Yes, I mean, we've had this conversation in the past. We were discussing about how healthcare should be, and my thinking about that is healthcare is done all wrong today. Today, it's based on fixing an issue that you're having, instead of trying to keep you healthy, instead of really focusing on well-being. That should be the main focus. And we have now all kinds of wearables. We have all kinds of data coming into the system, at a point where generative AI could come in and kind of bring everything together and really get to that target of very personalized medicine, based on all the data points, to be able to keep you healthy, and using the AI to kind of do this at scale for pretty much everybody, which today it would not be possible because you don't have enough professionals to actually support something like this. But with AI, the promise of good healthcare for everybody that keeps you healthy instead of fixing issues, is something that might actually happen. So that's my thinking about it. So putting in place all the building blocks, like digitizing everything that comes, putting the data together, because AI without data is meaningless, and putting it all together in a meaningful way, and then on top of it, having AI consuming all of that data and providing relevant information for the people who need it in the system, is definitely the future of healthcare, in my opinion.
One good point that you mentioned, the integration of information into the EHR. Technically, a lot of the information coming from the health devices, wearables, could be integrated to EHR, but in the past, there was reluctance to do that, because the moment you integrate, then you need somebody to monitor it, somebody to take action in it. Now with Gen AI's ability and agentic AI's ability to actually take action on it, obviously still under some level of supervision, because healthcare still needs a person involved. There is a much more openness to this sort of integration, which will open to a lot more opportunity for healthcare live, real time, and so on and so forth.
That's great. All right, so let's also, in terms of the agentic AI reshaping the way diagnostics and clinical decision making, we don't want to obviously take away the decision making of our doctors, but again, you already mentioned, Rajan, there's not enough doctors, there's not enough nurses, so we may need to fill these gaps with AI. So tell us about the diagnostic side of things with how that helps.
Yeah, no, that is a big revelation. I actually first thought that people will largely focus on the operational side and not so much on diagnostic side. But to my surprise, that wasn't the case. There is a lot of focus on the diagnostic side to make a physician's job easier, whether it is in radiology. Obviously, a lot of AI is getting involved in radiology, but also a lot of our clients are now digitizing their care guidelines and their method of taking care under various situations. They're digitizing that as knowledge graphs, and then integrating these knowledge graphs into the large language models, so that there is far more accuracy in the decision making. So yes, this is a big play. Our clients are focused on decision support systems. There will be always a physician in the loop, but they're also integrating knowledge graphs into it to get a lot of accuracy. And obviously, there's a lot of ability to then disclose and explain explainability of decisions because it is on their own guidelines and the historical way of how they have addressed a particular diagnostic situation.
Doing a proper diagnosis is I think very important. And I've personally had a very strange kind of a disease illness that wasn't, I've seen like 7 doctors, and apparently it's something that happens very rarely. I'm good and fine and everything, but they had to go to a very deep analysis and understanding and research until finally one of the doctors was able to understand what was going on with me. This very use case in the world of AI, it's gonna be um, done in a way better way, because it's generative AI is based on accessing a huge amount of data. So being able to see all of the people that have the same conditions globally, these are the promises of Gen AI. And I think for diagnosis in specific, I'm looking 10 years from now, and it's gonna change our lives, like for the better. It's gonna be like a huge transformation, in my opinion.
Also for diagnostic, but also for solving rare diseases because of the same issue. To solve rare diseases, you need enough data. Gen AI can, build data for you to then test on that data. And second, the cost of doing trials with Gen AI and automation should reduce 60 to 70%. So number of those drugs which maybe commercially are not viable today because the disease is so rare could become more viable if the cost of testing those drugs and trials of those drugs reduces drastically.
That's great. All right. So, we mentioned kind of case studies here. Let's get into one if you don't mind, Rajan. Do you have a case study of CitiusTech where you've significantly impacted patient outcomes or operational efficiency? You pick and choose your greatest hits where you guys came in and played a major play.
Yeah, let me take 2 examples. The first one, since we talked of decision support system, I'll give slight variation to that. So in nurses are obviously in really short supply, and ICU beds are also in equally short supply. If today a lot of time is taken in ICU discharge, number of forms have to be filled, and these discharge lists are not simple checklists because they change based on the diagnosis and because based on the situation of the person. So it's a very active checklist that a nurse and a physician have to come together to do. Takes a lot of time, which delays the ICU discharge. We have now created an agentic based application which allows significantly faster ICU discharge, thereby making that bed available to the next people and reducing significant effort, 40 to 60% effort from the nurse and the physician in that activity. And there are many more examples like that. Let me also take an example. You would have heard this is obviously a big issue of denials management. Uh, you know, Today, almost 95% of the claims, the decision on that is fairly automatic. But the 5% of claims do go through specific intervention because they are not standard, or the disease or the diagnosis is not standard or very expensive that it needs an intervention. And this has to be done by a nurse and a physician, so it's not a normal operations person who looks at these cases and denies or agrees. Now with leverage of Gen AI, the automation of care guidelines, the knowledge graph built on the prior claims that have been approved or not approved by the payers, this 5% which goes to intervention can be significantly reduced, and the automation can be improved from 95 to 97 or 98%, which will speed up the time that patients have to wait for approval from the payer for them to then go ahead with the diagnostic. So giving you an example, earlier in the provider use case of ICU discharge, and then in a payer use case of denial management and automating denials. So I think there are many use cases, both on the physician side as well as operational side, where our clients are leveraging and where we have delivered work for them.
What was the use case that most surprised you? Like the one that said, "Hey, I wouldn't have thought of this." What was like, the one that brought?
I'll tell you what it is a use case that you would normally think, oh, 100% virtual assist, to check on medication adherence or post care. This is very normal. But where my aha moment came, when you think of virtual assist, you are thinking of an audio call. But with agentic AI, what we built for a client in this case was a video call, and the patient. So they will normally ask, so do you have all your subsequent appointments done? And this person said, look, I need these 4 appointments. He just showed the 4 appointment, and the agentic AI was able to read and was able to then help them set up those appointments. That was a aha moment that, oh, this is not an agent which only talks to you. It actually visualizes, is able to see, is able to act on what they are seeing. It's far more sophisticated than what I was originally thinking in my mind, because my mind was, oh, virtual agent means I'm going to talk to you, get a checklist, ask you all the questions, and do a tick mark on those. So that was really the aha moment for me.
Yeah, that's amazing, because I'm seeing this, like everybody's now, I don't know if you're familiar with this, is everybody's talking about vibe coding. And actually, exactly what you said is enabling not just vibe coding, but vibe working. Like the entire way of the way we talk to technology, the way we interact with technology will completely change, because now the AI is able to read stuff that we are showing. It's able to see our screens, is able to interact with us in voice. So it's gonna really transform the way we work with technology in the future. And your aha moment actually kind of points toward towards that direction.
No, that's cool. And speaking, you said agents, and Rajan, we've focused the podcast recently on AI agents and AI workforce. How much of it does it come to play at CitiusTech in terms of, how much, I guess, heavy lifting these AI agents are doing for you?
I think there are 2 places where we use AI agents. One is in application development, coding development. There, obviously, it's far ahead, because, I feel a lot of our delivery of application work, coding work for our clients will be based on agentic AI. So today, I would say 25-30% of our work is being delivered to our clients using that. It'll go to 50, 60, 70% in 12 to 18 months. There should be no client who is not leveraging agentic AI for delivery. Then there is agentic AI in their care delivery. There, I think people are still a little bit apprehensive. They want to test it. They also want to make sure there are more purpose-built agents rather than more goal-seeking agent, because they want to keep control over the outcomes of these agents, and because these agents learn, and then they want to make sure that the models, the weights, the algorithms, they stay within the dimensions that are set. So they're far more careful in using agentic AI in care delivery settings. But I can see, like the example I gave you of a virtual agent, that's the next 12 to 18 months, you will see a lot more, because of the same issue that we don't have enough nurses who can call on people after they go out of ICU or after they are discharged into their homes, and
Yeah, it's also the same thing of, once you are at home, how do you deal with that setup? How do you bring technology, because you have all the wearables? Like I saw the amount of progress in the wearables alone. That could be one thing that could help, bridge the gap. So I think the promise of providing better support when you are home is a big one.
And Rajan, there seems to be a big push and pull in terms of the generation gaps. And this happens all the time. I think if anyone who has like elderly parents, and recently my wife was doing something online because our doctor and our healthcare system is basically 100% all AI with AI agents and everything is on an app. And she said to me, like, what if my dad was still around? Her dad had passed away like a year early. Like, he wouldn't be able to do this. But we are now seeing the boomers probably a little more tech savvy than the greatest generation, and obviously Gen X and the ones that come behind will embrace this. How much is the generation gap in terms of the push-pull of not going too fast, because there's a whole subset of people, if you want to say 70 plus, and there's a lot of them in this country. If people may not know, there's a lot of people living well past, their 70s, 80s. How much of that plays into how fast healthcare moves with technology?
Uh, it does play a role because obviously the younger generation, they're digital first. Like they'll be actually happy to stay out of doctor's office. They would be happy to do everything virtual. But it is proven that when people, you could have asked the same thing about Amazon. I bet you that actually most of these people are shopping on Amazon. They're not necessarily going to Walmart, people who are 60, 65 plus, because they find it comfortable. They can do it when they want it. I think healthcare is also now in that place where people will start to do more and more from their home. I think what Jerry mentioned about integration of this information into EHR, once that happens, right, which is still not happened. A lot of the software medical devices that people wear, their integration into the EHR is happening slowly. As that happens, they will find that the doctor or the physician or the hospital is aware at all times and is able to take an action whenever they need it. There's another thing which I think is interesting. Today, I still feel that GenAI is trying to solve for the problems that it sees today. So it will automate like ambient listening. There's a problem that physician is typing. Can I take the typing away? So there's ambient listening, which will now auto convert and feed into EHR. So it's solving for a problem that I see today. I think we are in the same place where the initial applications in mobile, till you had Uber, we hadn't really explored the power of mobile. When we start imagining, a device, GPS, the power of all of this coming together, then you get like a 5x better or 10x better application. I think you will get there in the next 1 to 2 or 3 years. Right now, GenAI is still trying to solve for a process that is broken. Reimagination of that process still hasn't fully happened. These aha moments, like the example I gave, more of these will help us reimagine the process ground up, and building a healthcare system ground up, or even an EHR system ground up, which is GenAI first.
We are talking about the generational challenges that you can have while interacting with technology, but also because we are thinking of technology the way we are thinking about last year or 5 years ago, the way we would interact. But in the future, that will change. As I mentioned, with this vibe coding, vibe working, is you will talk to technology. The technology will understand the context, will understand your issues, and the interaction will be very different. And yeah, I totally agree with what Rajan was saying, that today we are using AI to fix some of the steps in the process that we are already doing. But tomorrow the process will be very different. Like even in healthcare, instead of the health system waiting for you to go to them, it will be the other way around. They will identify that you potentially could have an issue and they will reach out to you proactively. That should be kind of the way of reimagining the workflow and the way we interact with these systems.
That's great. That's cool. It's funny. We talk about how it's changing things today, and because we kind of alluded to earlier, Rajan, about where it came from, where it was like paper and triplicate, and and then the EHR came around. How are you able to integrate a lot of this work that you're doing that's solving for today, but integrating it in legacy systems? Is that been a pain point, or are you guys kind of like above that stack where you're not involved in integrating in the legacy systems? Tell me more about that if you can.
We do that. In fact, to be very honest, that's where a large part of our revenue comes from, because clients need to solve for that before they can truly create a AI system or leverage all the data they have. So we today solve this in two ways for them. One is data modernization. Today they have data in different places, different formats. We need to create a full data framework for them, data architecture, whether it is using AWS, Google, or Microsoft Azure. They all have healthcare specific data models, or integrating data, or moving. The people have multiple EHR systems. Each EHR system is a totally different format. Moving that in and out for them to consolidate, that's really the work that we do. A lot of the work, a revenue that we get is either data modernization or application modernization, for them to take advantage of the new stack that they can get.
That's great. No, it's good. I was curious about that because I feel like, I mean, I talk to a lot of doctors and people in healthcare, Rajan, and you know this from being kind of in the battle the last 20 years. It's one of these industries, and I think many are, that like they don't like change. It's the idea of change is frightening, and they very much have that sort of old business school mindset of like, if it ain't broke, why fix it? Or, it's too big to fix. When you have those conversations with entrepreneurs, or John, when people say like, I don't know how to fix this. This is just too big of a problem. Is it just companies like you are able to like, or like, it's like the old business adage of, how to eat an elephant one bite at a time. Are you just one of those one bites at a time?
That's a good point you asked. I think for everybody has resistance to change, but in this industry, everybody understands this is a very noble industry. So if we go back to the why, I think they're much more open. In this case, the why is not about cost saving. So people are willing to take the journey with you because they understand the reason to do this is because they'll be able to serve the patient better, or they'll be able to serve a patient that today does not have access to it, because maybe they are remote, maybe they are in a place where doctor to patient ratio is so skewed that you have to wait months before you get access. So they understand that why. If we can solve that why, they are very open to be on that journey, and that's what I've learned working with them.
It's really the why in healthcare is very strong, very powerful. It's a big enabler. And if we go one step back, if it works, don't fix it. It's a valid point. But the thing is, there are so many changes coming up that if you're not willing to move ahead and try new things, you're going to be the one that is going to be disrupted instead of being part of the disruption. Instead of being part of the innovation, you're going to be the one that will have to deal with being reactive to what everybody else in the market is doing. This is not a question of should you do it or should you not do it. It's just a question of how you do it and how fast you go and the directions that you want to take. But if your answer is that, oh, I'm gonna wait for the next wave, I'm gonna wait it out, I don't think that's a smart decision.
Yeah, I'll also just add to that. It's not everybody knows that US healthcare system is probably the most expensive healthcare system. It's per person spend is 2x of what you see in Western Europe, for example. And we are not better in terms of any health outcomes compared to Western Europe. So obviously there is a lot of opportunity to improve. So there is understanding between this ecosystem of payer providers, life sciences companies, that there is room for improvement. And you are seeing, there's a lot of push now from government as well. So both you appeal to that sentiment and also obviously the why, I think there's a lot of openness for people to change.
Good stuff. Good stuff. And Rajan, to wrap things up, I have a pet peeve of mine where people say AI is a tool, and I don't want to be one of these hyperbolic persons that says that AI is going to change the world and fix every problem we ever had. But to call it a tool, I feel is almost like insulting, because a tool is like, spell check. And I think AI is bigger than that. And I think Eric Schmidt just did a talk where he said AI is actually underhyped, where a lot of people think, oh, AI is being overhyped. But give us your take in terms of not just within CitiusTech, but like the overall feeling of AI. Do you think it's underhyped or overhyped at this point?
That's a good question. I think it may be overhyped in the short term, but underhyped in the long term. So what I mean by that, I think the change that we'll see in 5 to 10 to 15 years will be very big, very drastic. And I don't think there's enough knowledge or awareness of what exactly that'll happen. So I would say that's why probably it's underhyped. In the short term, in the next 6-9 months, there's so much coverage. Every podcast, every discussion is about AI. So I would say it's overhyped in that sense, but the true change or achievement or what it can do for humanity is not still fully appreciated or understood.
Yeah, 100% agree with this. Like short term, I think it's overhyped. And it's also because many of these companies that are pushing out the generative AI things and the agents and everything need to make it sound that AI is like a fix-it-all and is going to address everything. And they need to kind of sell it and make it sound simple. But I think that once we are beyond this initial stage and we go a little bit deeper and we understand the nuances and we understand the depth of what this could do for us and our societies, I think it's very much underhyped, very much so. We are not even appreciating the extent of what this could do for us in 5 or 10 years.
Awesome. Thank you, Jerry. He is Rajan Kohli, CEO of CitiusTech. Rajan, if people want to find out more information about your organization, where should they start, sir?
CitiusTech.com. That's the best place to know more. And we would love to get more crowd.
Excellent. Thanks, Rajan. We really appreciate it.
Thank you, Joe. Thanks, Jerry.
Thank you.